This is a very interesting topic because the standard of care has been for years to do tissue NGS, next generation sequencing in tissue, to find what are the genetic aberrations that we need to use target therapy for lung cancer. Liquid biopsies, meaning doing the next generation sequencing, NGS, in the blood, has demonstrated already that it's as good as tissue. So what some of us are advocating is not enough that it's as good as tissue. The benefit or the advantage of liquid biopsies is that you can have a result in 7 days compared with the result of 3 weeks, 21 days as an average, or maybe more, that takes for the tissue. So our patients can have in 7 days an answer for what is the therapy for them. In our particular case, we have been running liquid and tissue for years, 6 years in our cancer center, and we have a lot of patients and we have a good samples, and we are demonstrating in this abstract that 70% of my patients at 7 days, they know what is going to be the best lung cancer treatment for them. Because even if you don't find any target, any genetic aberration, then you already know that the best treatment for the patient is the chemoimmunotherapy. So that's why even with a negative liquid biopsy, we already know that the patient doesn't have a target. So that's why it's funny, but the negative liquid biopsy indicates that the patient is a candidate for chemoimmuno. 30% of the time, after 3 or 4 weeks, the patients get the results thanks to the tissue. And that is why the tissue is very valuable. The only thing is it takes a lot of time. So that's why, in summary, we are trying to promote that really liquid biopsy should be used in the frontline therapy, frontline decision making, instead to wait for the tissue. So that was the idea of the presentation.